Hi, I'm Dr. Rajani, and today I'm going to take you through a microneedling facial procedure. You can either use microneedling with various serums. Today we're using hyaluronic acid, or you can use it with PRP to infuse platelet-rich plasma to rejuvenate your skin with your own body's platelets, which have growth factors, and stem cells, which rejuvenate new skin. Let's go to the video and we'll watch the procedure being done with hyaluronic acid. So today we're doing a microneedling procedure on the facial region, and what we're going to use is a new third generation microneedling device, and this device has 2 speeds and it's cordless, the particular one we're using today. What we're going to do, we've cleansed the skin with the Rajani MD all-in-one cleanser. We're going to give a final cleanse to the skin. You can use alcohol, some people use peroxide, just a final cleanse. And today we're going to be using pure hyaluronic acid. A lot of people feel they have pure hyaluronic acid, but actually it's a little more specific and harder to come by for the real product, and that's what we have today. We're going to put this on the skin surface. We're going to put a nice even coat, and you can see it's very, very thick. These are hyaluronic acid filling beads, and hyaluronic acid is found in every tissue in our body, but particularly in our skin, and it's very hydrating. However, if it's too concentrated, particularly in skincare, it can be dehydrating, and that's not good for the skin. And we're going to be using a 0.5 millimeter depth today, and that's going to provide a nice facial glow over the next few days. It's going to microneedle the skin, which means that there's going to be many small needles of about 31 gauge entering the skin and infusing this hyaluronic acid. And we can use many different products to be infused. We infuse PRP, which is a portion of someone's own blood, particularly platelets that are rich in plasma. And those plasmas have the plasma has growth factors and stem cells that rejuvenate skin. Now, we've already done some facial fillers, so we've revolumized. And now what we're going to do is help the texture and the tone of the skin, help restore a glow, reduce pore size, reduce brown spots. This is great for acne scarring and overall rejuvenating the skin. We're going to use a high setting here. I'm going to start on the patient's left, and we're simply going to microneedle. And we're putting hundreds of micro holes in the skin, micro needles. And as the skin heals itself, you can see we're going to depth where you can get a little bit of bleeding. As the skin heals itself, it shrink wraps so that it tightens around these micro holes. And again, we're infusing the hyaluronic acid. You can see we're just going into the deeper dermal levels, and you can see the patient has had a topical. I'm going to put a little more hyaluronic acid in this region. And that's why it's a very comfortable procedure. Now, as the skin heals, like I said, the skin tightens around these micro holes. It's not unlike a laser procedure in which you use laser columns that go deep into the skin and also produce some heating. Now, if we have an area of acne scarring, we can also go a little bit deeper. The chin is a little more sensitive, but will produce a great effect down here. if you do have acne scarring, it will tighten around these areas and will reduce scarring greatly. And occasionally, we'll have to go to even deeper levels. So we'll cleanse that area a little bit. You can see those micro holes that we formed. Cleanse that area. And just many, many tiny micro holes. Told you this way. I'm going to reapply some hyaluronic acid here to make a nice substrate, nice surface. And this will help with crow's feet, reduce the brown spots, tighten the skin, and because it's natural, there's no foreign substances other than this hyaluronic acid. Go again quick. We'll go up and get those crow's feet. That will reduce her need for Botox. The skin is like a tablecloth, and the substrate below is very similar to the table itself. And the table needs structure, legs, and support. And that is fillers, just Sculptor, Artifil, Juviter, Restylane, Perlane. And the tablecloth is that beautiful skin on the outside. Okay, I'm going to go to the upper lip here, and those vertical lip lines are very important. It's sensitive, but microneedling this area, although it's a little sensitive, will reduce those rhytids or wrinkles and provide that beautiful skin. The jawline, where the jowling is, we want a nice tightening effect here. Let's come up and get that under eye region. Just to tighten that skin. And these areas, I wouldn't dare use a filler up here. It's just too close to the eye in the very under eye. You can use a filler in the tear trough, but you don't want to use it on that lower lid region. And then up in the temple. We add a lot of volume up here as time goes on, because that's what lifts the whole face and provides more structure and support. This way. We're going to do that forehead, and we're going a little deeper. Going to add a little more hyaluronic acid, but because there are large pores that I can see up in this forehead, we're going to go a little deeper than we might go. But we also want her to get the results she wants. We don't want those large pores because that's a sign of aging skin. And again, this is an area that people like the Botox. If you can decrease your need for Botox up here, patients love that as well. Let's not forget the other side of the lip. There we go. Let's get that eye region. We'll do that eye and those crow's feet on the left side, and that will complete our project. So again, these crow's feet, this will shrink wrap the skin up here and tighten those areas, decrease the need for Botox, and the hyaluronic acid is going to make this skin beautiful and glowing, and that crinkly skin below the eyes is going to decrease. So you can see we are penetrating deeper. This is a medical grade procedure, okay, because we are going through the dermal layers. We want to stop those lines right below the eyes. We don't want to use a lot of filler there because it's going to make her look unnatural. Same with the crow's feet. Beautiful tight skin, and that hyaluronic acid is going to go in and infuse and build collagen. And we can finish with a little topical hyaluronic acid. We use the patient's platelet-rich plasma and we apply it on the skin just like we did the hyaluronic acid and infuse it that way. We can also use the micro cannula, and with the platelet-rich plasma we can really infuse those areas that are right on the lower lid that we don't want to fill. And I tell her for follow-up, I don't want her in a hot tub. I want to keep these areas clean. No makeup for 24 hours until things heal up a little bit. It's not going to harm the effect, but I don't want her to break out or get acne. So that's a microneedling procedure. For her, I'd recommend 2 or 3 more, and we're actually going to do one with PRP, or platelet-rich plasma. On the side here, there's a lot of, you can see, just like a laser peel, those micro holes, micro columns that went deeper into the dermal layers, and the brown spots are going to lift up with those as well. There's an acne scar here, and I'll go a little deeper next time, and that acne scar will disappear. So there you see, that's microneedling with the brand new micro pens. It's a great procedure. It's relatively quick. We use a topical anesthetic. There's very minimal recovery time. Thank you for joining me today.